Check.
Hey, we have a wireless microphone if anyone has any questions.
Or comments. Yeah. Everybody has a view and experience that I think we should hear if it relates to healthcare. Go ahead.
How you doing?
All good.
Good. I was just wondered if you could explain a little bit as to why you think the opt-in is backwards, and
For sex education, you mean?
yeah, from the schools, like the parents opt in instead of opting out.
Yeah.
And I was wondering, I bought the website smartphonefreechildhood.ca for Canada because I truly believe that the social media platforms are brainwashing, and it's the best propaganda tool probably known to mankind. So I'm just talking about the children here. So when it comes to the gender thing that's happening, I wonder if anybody's done any study or anything to find out how many children out there are getting or wanting to change their gender because it's the popular thing to do on social media.
Well, I think you've raised some important points there. In relation to sex ed, everyone needs to have a foundation in understanding our sexuality. There's no question that if you're going to be healthy, you need to understand and be able to talk about your sexuality, your gender identity and your gender expression, consent or not consent to physical touching or sexual activity. To make that an opt-in means that many children are going to be left out of that foundational education. Simply because a parent isn't comfortable with the issue, or because they fail to sign the form that they didn't get or they didn't see, or so there are a number of reasons why they might never get signed, and that child, in my view, will be very disadvantaged in terms of his ability to, or her ability to deal with sexuality in the coming years. With respect to the trans issue, what you say is being confirmed in some circles. A child psychiatrist friend of mine says the most challenging thing he's dealing with now is the number of young people coming saying they think they're trans, and the strong emphasis on supporting that instead of giving it time and challenging it and showing some understanding, and not simply accepting it as reality in the early years when young people are understandably challenging or questioning their gender and sexuality. That's part of what growing up is about. So it needs to be handled delicately, but the Premier removing the freedom of the individual to communicate about their pronouns is not appropriate. It's not helpful. It can be very, I think, damaging to the process that needs to happen. Her interference in the gender assignment and medical changes that may be needed to assist, as they were in my granddaughter's case, the transition in a careful, timely, and sensitive way, is not appropriate. Politics should not have a place in what is so foundationally a social and medical and personal issue, in my view. And social media is a tremendous danger on so many fronts, isn't it? It's creating a tremendous amount of anxiety and problems with young people in their self-esteem and their presentation of themselves. Far from improving communication, I think it's been a tremendous barrier to relationships, and I support you in what you're trying to do there. Another question.
Thank you, David, for what you've said so far. And what piqued my interest was your comment around Jane Philpott. And I've listened to some interviews with her, not read her book, but my sense is that what she has to say could have profound impact across Canada, let alone in Alberta, if we choose to go that route. So in a nutshell, can you tell us what that route could be?
Jane Philpott's route? Well, I can't say that I've read it in depth, but I've read a couple of articles in the Globe that highlighted some of her suggestions. Certainly primary health care has to be the main issue. And hopefully family physicians will be esteemed. They will be an important part of the team approach to care, because family physicians cannot provide everything. They need a team around them, whether it's nutrition and psychology and those sort of ancillary supports. And just to set a target is a huge issue if we haven't even set a target that 100% of Albertans should have a family physician or a nurse practitioner. Just to set that target and then start measuring it is an important way to move it forward. So investing in primary prevention and in primary health care with a physician or nurse practitioner, and ensuring that we fund these appropriately, I think are keys to what will improve our system here in Alberta for sure. But I'll have to read more about Jane's suggestions. I haven't read her book either. Okay, thank you.
Thank you for donating your time. I want to know if you have any views on this new private profit urgent care that is coming in Airdrie, and that is the prototype for going across the province.
Private for-profit primary care in Airdrie. I've only heard about it. What I can say in general is that privatization has always been an option in the Canada Health Act, but you can't be both in the public system and paid by the public system as a physician and also be taking money privately from people for a service that is medically covered. Now, there are many clinics that are kind of threading the needle, I guess I would say, by saying, well, I'm billing the public health system for the medical services that I provide that are medically covered, but I'm also billing privately for your filling out your driver's license report or your workers' compensation report or giving you lifestyle advice. That's a private thing that not everybody is not necessarily covered by the Public Health Act. So some people are benefiting and playing both sides. And we're seeing some of those clinics crop up all over Calgary and Alberta and Canada, actually. But if to follow the true Health Act, practitioners have to opt out of the public health system if they're going to be a private for-profit service. And as I've said earlier, the evidence is that private services cost more, they lead to cherry picking, and they don't necessarily provide any better service. And they suck. They actually attract physicians and practitioners out of the public system, so they actually make it more difficult in some cases to get care. Did you need a follow-up there?
I was referring to urgent care.
You're referring to urgent care.
The new
Private.
urgent care in Airdrie, which they asked, I'm not sure what his name is, Dr. Klein to gave him $85,000 to come up with a proposal, and they're providing him with an entire urgent care facility, including a CAT scan.
Well, I'll need to learn more about that, but the fundamental principle here in Canada is that we don't believe that your access to care should depend on your income. Private care implies that you're going to pay for the service, and that violates some pretty fundamental Canadian values that we have supported for, well, since '64. So we have to resist that. We have to resist that. Yeah. Yeah.
I lived for many years with my wife Susan in Briar Hill in Calgary. I want to thank you again for your service as an MLA in Calgary-Mountain View. You were outstanding.
Thank you. Thank you.
I would also like to thank you for your remark about preventative health care. There have been a number of us old jocks for the last 20 years who've been trying to improve access to sports infrastructure and our recreational infrastructure at the same time. We don't believe it's a good idea to put fees on parks.
Put what?
Fees
Fees.
on our public parks.
Right.
Or to increase the barriers to access. The sports participation in organized sports especially has declined, and we see that as having an impact, a long-term impact on the physical health of the population.
And mental health, I would
And
say.
the mental health, because
Absolutely.
it's also a social connection as well as a physical benefit. So thank you for mentioning that. It's much appreciated.
Thank you. Yeah.
Hi, Dr. Swann.
Hi.
Yes, you represented me when I was in West Hillhurst, so thank you as well. I thought you were an excellent MLA.
Okay.
And I'd just like to echo the comments on prevention and the work that my friend Miranda and I here do with For Our Kids Alberta. We have been looking at methane in our atmosphere. And so when we look at getting kids outside, we also have to look at where the flare sites are in relation to their schools, in their daycares, relation to their daycares. This is happening all across our province. We have methane leaking, flaring, venting, leaking into our atmosphere. And most of Alberta has no idea that this is happening and that this is sometimes happening on school grounds. So in terms of prevention, I just want the room to know that there are a few of us that are really digging into this, and we can't ignore our environment when we're looking at prevention for healthcare.
Very good. Thank you. Mark Doran over here will have more to say about leaky wells and off-gassing and the incomplete combustion that results in many toxins, not just methane, but terrible.
I already did. Hi, David. David and I had the pleasure of working together in public health for several years. Out of my 46 years in nursing, 36 have been spent in public health. I currently work in health promotion, and they are dismantling our health promotion team as we speak. As people move on or retire, their positions aren't being filled. We have been told in my department that we are not able to travel anymore. I work in a rural area, so travel is very important. And public health nurses who used to do baby visits, going to moms in their home, are not allowed to do that anymore. Now we are having moms come into the clinic a few days after having a child, and sometimes with other young children in tow. It's not just the acute care and primary care systems that are being attacked by this government.
Thank you. Yeah.
I'd just like to further comment on how the Alberta government is using our tax dollars, our non-discretionary tax dollars, to fund a for-profit emergency care facility in Airdrie. And we didn't vote for that. They're there to represent our requirements and to provide services that we all pay our taxes for, instead of diverting those taxes, those non-discretionary taxes that we all pay. And we pay with the idea that the politicians will represent our requirements before anyone else's. That's the deal. You can come in and set up business, but that business has to be of benefit to everybody that lives there, not just to the business. And the fact that an ex-premier, Ed Stelmach, is the head of this health consortium seems to me to be a gross conflict of interest when somebody who's held the highest position in Alberta is now trying to divert for-profit funds to a, what are they called?
Covenant Health.
Covenant. It's like covetous health. And we should not be allowing for that. That is not what we pay our taxes for. Those taxes, if we don't pay our taxes, we go to jail. But they are allowed to, you know, abuse and misuse the taxes that we pay for services that should be funded. As you were saying, not replacing staff that, you know, like it's called natural wastage, where that person's job is going to someone in the private sector. And you do not have the what's the word I'm looking for? The safeties in place when you choose to use a for-profit, because you are then signing a contract that they have, you know, brought about that benefits them and not you. So we should, as everybody's saying, in Canada, the reason that our society is so reasonable is because we don't have to worry and fight with everybody to get, you know, taxpayer paid for services. Everybody should, you know, is being looked after. But now this government is trying to split people. And, you know, I'm very, very disturbed by it, I'm afraid. Here, I'm not
I'd just like to clarify one thing. Ed Stelmach is a chair or a board member of Covenant Health, and this government has decided that some of the hospitals will fall under Covenant Health. Not private. They're a public body, and they provide publicly.
If it's okay, I'm going to cut off questions for this speaker.
We can talk further another time. Yeah. The other thing to remind you of is that if Alberta violates the public health or the Medicare Act, the federal government has a responsibility of stepping in, and they did that in the Klein years when they withheld something like $28 million from Alberta because Ralph Klein was allowing some private clinics to develop. So it is a federal role to intervene, as well as us. We can certainly intervene when we disagree with the privatization that's going on subtly and quietly, increasingly across the province. The federal government has the primary responsibility for sanctioning private and for-profit operations under the Canada Health Act. Thanks, David.